you doing today? Okay. Are you feeling any better? I know you've been in the hospital for a few days now. Your doctor asked me to come in and to check on your breathing. I'll be giving you some medicine and showing you some relaxing breathing techniques to help you breathe better. Is it okay if I come a little closer? Okay, great, thank you. So tell me, have you had any trouble breathing? Okay. Have you been coughing at all? Okay. Okay, well, I'm here to help. If you don't mind, I'm gonna just listen to your lungs at first, okay? And then we'll do some breathing exercises, and then we'll see how you feel after, okay? So the first thing I'm gonna do is I'm gonna sanitize my hands, okay? Make sure I don't give you any germs, all right? There we go. Okay, so my hands are all clean for you. And can we just quickly verify your full name and your date of birth? Perfect. Okay. All right, so I'm just gonna listen to your lungs, okay? All right, so when I put this on your chest, okay, I just need you to take a deep breath for me, okay? Okay, ready? Deep breath. Good. The other side, okay? Deep breath. Great job. Okay, I'm just gonna listen to the back now, okay? All right. Deep breath. Wonderful. One more time, okay? Deep breath. Great. Okay, now we're gonna do something a little different. I'm gonna listen to your lungs again, but this time I want you to say 99, okay? Ready? Okay. 99. Good. 99. Perfect. All right, now the back, okay? Okay. 99. Good. Last time, okay? Okay. 99. Wonderful. Okay, all done with that. Now, did that hurt at all? Did you feel any burning or any sensation to cough or anything like that? Okay, okay, that's okay. I'm here to help, okay? All right. So what I'd like to do now is I'm gonna put my gloves on, okay? And then I'm gonna show you some breathing techniques. And actually what I'd like to do is I'd like to start with a quick breathing treatment for you. And I'll show you that. I promise it won't hurt. I think you're gonna like it. All right, so I'm putting on my gloves. And then okay, they're on nice and snug. Ready? Okay, so the first thing I want to show you is this. And as you can see, it's called an aerobica. Okay, see that? Okay, and I know it looks scary and it's not very big at all. And this is the mouthpiece, so this is where your mouth will go. And this one is actually a sample, so I'm gonna show you how to use it. And I brought you another one just for you that you'll use, okay? And so the medicine goes in here, okay? And there's a filter right here. Can you see it? Filter. And then in here, you're gonna hear a little pleasant rattling sound, okay? And I'm gonna show you what it sounds like, and I think you're gonna like it, okay? And it's gonna help loosen any secretions in your lungs, and it'll help you breathe a lot better, okay? All right, so here, this is what it sounds like. You ready? Okay. Don't worry, just relax. Everything is fine. So you're gonna take a deep breath before you do it, and then you're gonna blow into it, okay? Did you hear that? Let's try it again, okay? So you're gonna take a deep breath, and you can actually put your mouth on the mouthpiece when you take a deep breath, and that way you'll inhale the medicine that's in here, okay? All right, so you take a deep breath, and then you're just gonna blow right it out, okay? Can you hear that? Let's do it again. And then blow out. How does that sound? Let's try it again, okay? What do you think? I think it sounds really relaxing. And you can feel it in your chest. And it's not too fast, and it doesn't hurt at all, and it's really pleasant. Let's try one more time, okay? What do you think? I'm gonna leave one here just for you so that you can do it on your own time, okay? You can do it as many times as you want, and there's absolutely no harm in doing it, and there's only benefits. And then I wanted to show you one more thing. If you look down here, you can see that there are different levels. So if you want it to be easier, you just move it to the level 1, like that. And if you want to make it harder, you can move it to the middle. Or if you want it to be really hard, you can move it all the way here to the 5, and that'll give you a deeper rattle, a deeper treatment. So let me show you what the 5 sounds like, okay? So you do the same thing. You take a breath, and then you blow out just the same. Did you hear that? Let's try one more time, just so you get a really good listen. What'd you think? I think it's really gonna help, okay? All right, so then there was one more thing I wanna show you, and you may have seen this. A lot of my patients use this after surgery, but really anybody can use it, and it's one of these. Have you seen it before? I'm sure you have, and a lot of patients after surgery or after a procedure use it, and it really helps to open the lungs up, and it helps to breathe better and deeper. And with this one, you're actually going to be inhaling, and you're going to hear a very slight little a little whistle sound from it, okay? And so this is a sample one. I'm just going to show you how to use it, and then I'll leave one here just for you, okay? So for this one, here's the mouthpiece, and it has this interesting little accordion piece. Can you see that? You can kind of play with it. It's kind of fun. And it can go in any direction you want. And then the goal when you take a deep breath is you have to have a very controlled breath. You can't just go like that. No, it has to be very slow and purposeful. So you're gonna go something like this. Very controlled, and you'll know that it's controlled because this blue little level is going to stay between this line and this line. See, it has to stay between the lines right there, okay? And then this here, this blue is going to raise up, and it'll show you how many liters you've inhaled. So the goal is always, it's right here, it's 2,500. Most people can get up to 1,000 pretty easily, okay? So we'll see how far you go, and then every day we'll try to get you higher and higher until you reach 2,500, okay? So let me show you how it's done. And this is very light. It's just plastic and air inside, so it's very light. And you can take it with you anywhere. As you can see, it's not very big at all. Okay, so this is how you do it. So for this one, you're going to exhale very slowly out first, not into the machine, but just out, okay? So you're going to go. Then you put your mouth on the mouthpiece and inhale. Did you see that? I kept this blue little lever thing between this line and this line. And did you see this blue? This went up, and I think I went just past 2,000, okay? Would you like to see it again? Okay, ready? I forgot to exhale first, so I did less. All right, let's do it the right way. I'm gonna show you the right way again, okay? So you're gonna exhale. Mouth on mouthpiece. Did you see that? I hit this line right below 2,500, okay? And with a little time and a little practice, you'll be able to do it too, okay? I know you will. I know it's hard and you're not feeling so good right now, but I promise you with a little time, you'll be mastering this with ease. And you'll get to show all your friends and your family just how well you're doing, okay? That's my job. My job is to help you feel better, okay? And I'm very good at my job. Okay, would you like to see me do it one more time? Okay, one more time, okay? And watch, don't watch me, watch this right here, and watch as this goes up, okay? So I'm gonna exhale again. Mouth on mouthpiece. And notice how my results differ every time. So each time won't be the same. The important thing is that you're close to it, okay? It doesn't have to be perfect, okay? And it doesn't have to match every single time. Sometimes you might hit 1,000. Sometimes you might hit just above 1,000 or just below. And you might actually, when you do it, you might hit 2,000 right away. Okay, it really depends, and it's okay. You don't have to worry. Okay, and this is almost this is just a tool for you to use to help you breathe deeper and breathe better. Okay, all right. So, would you like to try it now? All right. So we'll start with this one. Do you remember how to use this? This is the sample one. I'm going to show you this one again. Okay. So this one you actually can inhale with the mouthpiece and then exhale into the mouthpiece. And it makes that soft little rattling sound, okay? Listen. And then exhale. You hear that? Let's do it again. Okay, good. So you're gonna try this one first, okay? And then once you do this, I want you to do this one, okay? And then as you start to feel better, you can actually do this one first, then do this one, okay? Then do this one, and then do this one again to see how much this one has helped you. Okay, but I want you to do this one first for the first few times that you do it, so that you don't get too disappointed if you score a little lower in the beginning. Okay, because everybody scores low in the beginning. It's nothing to worry about. It's nothing to stress about. Okay, it's absolutely normal. All right, so I'm gonna leave you yours here with you, and like I said, you can do it anytime, as many times as you want. Okay, I recommend doing it about maybe every hour or every 2 hours. A good rule of thumb is every time you get up to go to the bathroom, when you come back to bed or come back to your chair, go ahead and just do it for a couple of minutes. Do both of them, okay? All right, so before I leave, I'd like to take another listen to your lungs and heart, if that's okay. And I'm also gonna check your oxygen saturation on your finger, okay? Just to make sure you're getting enough oxygen, okay? All right. So I'm just gonna listen to your lungs. But this time when I listen, I want you to take very slow breaths for me, okay? Not just, but I want you to go. And then really slowly exhale. Okay, because that's going to help me hear all the little imperfections in your breathing, and it'll help me to better assess what kind of treatment you need going further. Okay? All right. Okay. You ready? Okay. Okay? Okay. Here we go. So nice, slow, controlled, deep breath, okay? Inhale. And then very slowly. Very good. Let's do the other side, okay? Okay, inhale nice and slow, and let's do it through mouth open this time, okay? And then very slowly, mouth open, exhale. Wonderful. Let's do the back now, okay? All right. We're going to do it exactly the same way. Nice, slow, deep breath, mouth open, and then mouth open, nice, slow exhale, okay? Ready? Okay. Deep breath. And very slowly. Wonderful. Okay, one last time, okay? We're going to do the back on this side, okay? All right, ready? Really long, nice, deep breath, okay? Mouth open, don't forget. And then nice, easy exhale. Perfect. Okay, very good. And then, okay, very good. How did that feel? Did that feel okay? Okay, good. So before I leave, like I said, I just want to check the oxygen in your blood. I'm gonna take my gloves off now, okay? Okay, there's one. There's the other. Okay, so now what I'd like to do, like I said, is I'm gonna check the oxygen in your blood, okay? And I promise you it won't hurt. And see, it's gonna light up in here. Maybe. All right. There we go. Okay, so it's gonna, see there, the little light in there? Okay, so we're just gonna put your finger in like this. It doesn't hurt. It's actually really soft in here if you look. See that? It's really soft in here. So you just put your finger in, and it's gonna close it, and it's gonna be like a nice little hug on your finger, okay? And it'll help me, it's gonna tell me the oxygen level in your blood, okay? Okay. You ready? Okay. Just put your finger in. There we go. Your oxygen level is really good. Yeah, I think, see, it's done, and it's reading it really well, okay? And I think that once you do your treatments, once you do both of these, remember this one? Yeah? And then you'll also do this one as well. And I think once you do them, I'll come back tomorrow and I'll check it again and I'll listen to your lungs again. And I think you're gonna be much better, okay? Do you have any questions for me? Okay. Yeah, of course. I'll let your nurse know. Okay. It was really nice to meet you, and I hope you feel better very soon. Okay? Have a wonderful night.